Hi there, my name is Mikhail and I'm here with Matthew, and we're students at the Georgetown University School of Medicine. And today we're going to be talking about Medicaid, Medicare, the DC Healthcare Alliance, and in general, some tips on medication management. Yeah, so our presentation today, we're kind of building off of what some of our colleagues did last year on their video on a sample virtual visit with the doctor and how to request prescription refill. And so I just wanted to summarize their main tips, which was to reach out to your pharmacy at least a week ahead when you're low on medications. That way there can be some buffer in which you can get that refill. Also, you can stay in touch with your physician via patient portal, which is online. Making some refill requests there, or a phone call. But if you're able to set up that patient portal, which a lot of physicians will have, that makes it easy. Also, since we're still being affected by COVID-19, it's easier to get 90-day supplies of medications or longer supplies, which limits your need to go to the pharmacy, or even for those who might have home delivery of medication set up, getting less frequent deliveries. And it's also particularly important to stay adherent and keep extra medication at home, which is something that we're going to cover again at the end. But right now, we're going to move into how to access affordable healthcare. And so this is primarily through Medicaid, Medicare, and the DC Healthcare Alliance. And yeah, we're also, this is for those who don't have insurance through work.
Yeah, so to provide a brief introduction to DC Medicaid, we're just going to kind of first talk about what it is, who's eligible, and then the services it covers. So to read along here, so what is DC Medicaid? DC Medicaid is a healthcare program that pays for medical services for qualified individuals, which is what we're going to elaborate on in a little bit. It helps pay for medical services for low-income or disabled individuals. So for those who are eligible for full Medicaid services, Medicaid pays for your healthcare providers and their services. And then providers are individuals who are doctors who may work at hospitals and pharmacies and who are typically enrolled in DC Medicaid. So who is eligible? To be eligible for DC Medicaid, you must be a resident of the District of Columbia, as well as being a U.S. citizen, permanent resident, or legal alien in need of healthcare insurance / assistance, and then whose financial situation could be characterized as low income or very low income. And this is something that's going to be further defined during your application. You must also meet one of the following criteria. So you, in addition to what's above, you can be either pregnant or be responsible for a child 18 years of age or younger, or blind, or have a disability or a family member in your household with a disability, or you can be 65 years of age or older. And so what services does Medicaid cover? These typically include doctor's visits, hospitalizations, eye care, ambulatory surgical center care, and then medically necessary transportation, dental services and related treatment, dialysis, durable medical equipment, emergency ambulatory care, hospital services, laboratory services, radiology, medical supplies, mental health services, physician services, nurse practitioner services, home and community-based services, and as well as transplants. So a wide array of different healthcare services. So to continue, where do I apply for this? So you may apply for Medicaid for low-income families and children under 19 and pregnant women at your Income Maintenance Administration's Service Center, so IMA Service Center for short. You may call your service center at this provided number, so 202-727-5355, to locate the nearest center to you. You may also apply for benefits at the IMA service centers listed to the right. So these service centers include one located in Anacostia, Congress Heights, Fort Davis, 8th Street, and Taylor Street.
Okay, great. So next we're going to talk about DC Medicare, or Medicare in general, which is federal government provided health insurance, which is given to those who are 65 and older or 18 plus with qualifying disabilities. And Medicare can be a very complex and somewhat intimidating healthcare insurance plan to look at. But we're going to try to break it down into some of the basic parts and give a general overview in case you are eligible to get it. And so there's 4 main parts to it. And so part A is you can think of as hospital insurance, or for those insurance for a skilled nursing facility. And so this is going to cover those inpatient visits when you go into the hospital, your bed, and often treatments that are associated with that. Part B is more for your typical doctor's visits, be that in an office or in the hospital itself, and some of the costs that come about with that. Part C is somewhat of a separate idea from Part A and B, in that it covers what Part A and B's have, in addition to some of the other supplemental services like vision and dental. And so Part C is also known as Medicare Advantage. And so if you hear of people with the Medicare Advantage plan, it's often somewhat of an all-encompassing plan that you will get if you don't have Parts A and B. And so that's actually where one of the main divisions is introduced. But just to finish off the discussion of the different parts, there's also Part D for Medicare, which is prescription drug coverage, which you can either get as standalone or it is included in some of the parts, the Medicare Advantage plans in Part C. And then finally, there's Medicare supplements, which often help cover some of the services or costs that are not included in Parts A and B. So again, a lot of complexity to that, but if you look on the image posted, this is somewhat of a formulation of the original Medicare type plan, where often people get Parts A, B, and D together in addition to a Medicare supplement, because they cover kind of different ideas, which I went over, which is one option, but then often some other people may go with a Medicare Advantage plan. And so which one you're going to go with kind of depends on your needs. And so that being your healthcare needs, and so what type of benefits you want. And that goes hand in hand with costs, which again are varying depending on the plan. And so in a general, Medicare Advantage might be a little more expensive if it with premiums, if it bundles everything together. But depending on your needs, often the original Medicare plan may make more sense. And so there's a tool, there's some tools online, but one here that's posted where you can, depending on your needs, you can look into which plan makes the most sense for you. But something that I'll say is often if you've been with a provider, a lot of people choose to go with the original Medicare plan if that provider doesn't have Part C coverage. And so you're able to sign up on Medicare.gov 3 months before turning 65. And just a final note that I'll mention is that if you've already had Medicaid, in DC in particular, there's the option for dual coverage. And so if that's something that is eligible, that's relevant for you, that's something that you can also look into.
Yeah, so now we're going to look into something that will help with cost of your healthcare services if you do not qualify for Medicaid, as well as if you do not have private insurance. And so one thing that's unique here in DC is that DC has this DC Healthcare Alliance program. They also have a trusted, what's called the Trusted Health Plan that encapsulates some of the services that we'll go through in a little bit. So first, to kind of describe what this is. So DC Healthcare Alliance offers a full range of healthcare services for its members. This is going to include inpatient hospital care, outpatient medical care, including preventative care, emergency services, urgent care services, prescription drugs, rehabilitation services, home health care, dental services, specialty care, and wellness programs that include mother and baby care. And most of these are listed to the right as well. So who is eligible for this? You have to be an individual that lives within the District of Columbia, as well as I kind of mentioned before, you have no health insurance prior to this. So this does include Medicare and Medicaid, and typically make less money before taxes than a certain limit. And this limit is going to be further identified in your application. So again, just to run through some of the services, you have preventative care. These include checkups, diet, nutrition, health screening, tests, prescription drugs, dental services, cleanings, and this includes cleanings or fillings, family planning services. So this is things that include birth control, urgent and emergency services, immunization, so all of your shots, prenatal care during pregnancy, and then well child care after pregnancy, so checkups for children, wellness programs, so things that involve information about eating well and genuinely staying healthy, as well as the typical hospital care, so medical, surgical, and gynecological visits. So a little more continued, so focusing in on pharmacy services and prescription drugs. So in essence, pharmacies are where you pick up your medication. The drugs that you've been prescribed during a doctor's visit. So if your doctor gives you a prescription, you must go to the pharmacy in Trusted's network. And again, this is in relation to Trusted's health plan that's under the DC Healthcare Alliance. So Trusted Network includes most pharmacies within the district. And then you can find a full list of these pharmacies in Trusted Network online at the provided link here. One thing to note is that if you're out of town or you have an emergency or need urgent care and you need a prescription filled, all you need to do is just contact the member services department at the or nurse helpline at the following number, and you can get your prescription refills when you're out of town. And taking this another step further, so to get a prescription filled normally, so you pick up your prescriptions at a pharmacy that is part of Trusted Network and is typically close to your work or home. When you have a prescription, go to the pharmacy and give the pharmacy or pharmacist your prescription and your trusted member ID card. And if you need help, please call again the member services that's listed at that network or at that number. And then a couple of things to remember. So you should not be asked to pay for your medicines. Again, this is covered. Your medications will be covered through Trusted Health plan. And if they do ask for it, again, call the member services number that was provided above. And then sometimes your doctor may need to get permission for from Trusted to give a drug. So while your doctor is waiting for permission, you do have the right to get the medication under two conditions. So for up to 72 hours or for one full round of medicine if you take it less than once a day. And so to round some of this out, so how can you join Healthcare Alliance, DC Healthcare Alliance? You basically fill out an application at any one of the places listed to the right here. So either at DC General, Hunt Place Clinic, Woodridge Clinic, Anacostia. There's also Southwest Community Clinic, Greater Southeast Hospital, Congress Heights Clinic, Walker Jones Clinic. And then after you submit your application, it takes about 30 days for you to hear whether or not you're qualified. And if you are eligible, you will receive a membership card. And then once you are enrolled within the Alliance, you must fill out this form annually or every 12 months to prove that you're still eligible to receive these benefits.
Right. And finally, we wanted to wrap up just reiterating the importance of medication adherence. And so this is after you have your healthcare plan and you're receiving some kind of prescribed medications for whatever condition that you may have. And so just as a statement, failure to follow a medication regimen, which is taking your medications on time, is recognized as one of the top reasons for the failure of your treatment or having some serious adverse reaction. And so if for whatever reason, you're having some side effects, which can be one of the main reasons that people stop taking their medications, you should immediately contact your physician. And also as a reminder, people often forget that you can ask your pharmacist about any questions that you may have with the medication before you start taking it. And so again, it's critical to stay on top of this because failure to take your medications can be a very serious thing. But I also wanted to add that not taking medications is common, and there's been a lot of embarrassment and shame in this behavior. But just know that because it is common, many providers are used to this, and so do not be embarrassed sharing if this is the case. And we're also going to give just some general tips on how to follow your medication regimen if you might need some help with this. And so taking your medication at the same time every day is a general way of being on schedule or having a routine with taking medications. And so also taking your medications with your daily routine, like brushing your teeth or getting ready for bed, can be useful. And also keeping a medication calendar with your pill bottles and note every time you take a dose can be important to remember what you're doing. Using a pill container that also is large enough and contains different times, such as morning, lunch, and evening, if that's relevant for your schedule, can be useful as well. And also in refilling your pill container, you should refill it at the same time every week, so that when you remember to refill it, and two, if any issues are encountered, you know when maybe you should have refilled it. And then also having some kind of timer during the day, whether that's on the pill container itself or through your phone, is also useful, or through your watch as well, in remembering to take your pills. And then as a final note, when traveling, make sure that you bring enough medication. And if you are flying, make sure to bring it in your carry-on if you can, to avoid any issues with lost luggage. So.
Yeah, and so to end our presentation today, we have a couple of links specifically for DC Medicaid. As we were kind of talking about before, the process can be a little bit confusing, and so we wanted to provide these two links here to help navigate some of the smaller parts of the process and to figure out a little more about what may be pertinent to your specific application. So in saying that, thank you for watching. And if you have any questions about the process or want to get in touch with us, the Georgetown Medical Students, please feel free to reach out to your pastor, as we can help kind of navigate some of the process for you throughout the course of this upcoming semester. So thank you again for taking the time to listen to our presentation.